We continue with components of comprehensive review of systems. Genitourinary. Ask about urgency, frequency, dysuria, colic-like pain in flank area, suprapubic pain, facial puffiness, nocturia, hematuria, polyuria, oliguria, unusual or change in the color of urine, stones, infections, nephritis, hernias, hesitancy, change in size and force of stream, dribbling, acute retention or incontinence, note type, for example, stress, overflow, changes in libido, potency, genital sores, discharge, and sexually transmitted diseases. Ask male patients about the age of onset of secondary sexual characteristics, achieving and maintaining an erection, ejaculation, fertility, testicular pain or masses, and frequency and technique for performance of testicular self exam. Ask female patients about age of onset of menses, length and regularity of menstrual cycles, date of last pap smear, date of last menstrual cycle, dysmenorrhea, menorrhagia or metrorrhagia, vaginal discharge, vulvar itching, postmenopausal bleeding, dyspareunia, hormone replacement or contraceptive therapy. Describe fully and note any possible contraindications to same, such as a history of thrombophlebitis, type and frequency of sexual activity, number of sexual partners, infertility, number and results of pregnancies, gravida, para, complications of pregnancy, delivery, or the postpartum period, for example, postpartum depression, and type of delivery, for example, normal, spontaneous vaginal delivery, use of forceps, cesarean section. For the breast, we inquire about breast masses or lumps, lesions, tenderness, swelling, nipple discharge, dimpling, retraction of any area of the breast, and frequency and technique of breast self examination. Males may also develop breast cancer. They should be questioned about any discharge, masses, etc. For musculoskeletal, we question about the experience of pain, swelling, redness, or heat of muscles or joints, bony deformity, limitation of motion, muscular weakness, atrophy, and cramps. Neurologic, ask about headaches, lightheadedness, convulsions, paralysis, in coordination, sensory changes such as paresthesia, anesthesia, and hyperesthesia, changes in mentation, fainting, syncopal episodes, loss of consciousness, difficulties with memory or speech, sensory or motor disturbances, or disturbances in muscular coordination, ataxia, tremor. Mental, psychiatric. Ask about predominant mood, emotional problems, anxiety, depression, including suicidal ideation if appropriate, difficulty concentrating if previous historical data suggest, assess for domestic partner and or elder abuse, previous psychiatric care, unusual perceptions, and hallucinations. Lymphatic, inquire about local or general lymph node enlargement or tenderness or suppuration. Hematologic, question about anemia, abnormal bleeding or clotting tendencies, previous transfusions and reactions, and Rh incompatibility. Endocrine, inquire about polydipsia, polyuria, polyphagia, unexplained changes in weight, changes in skin texture or hair texture and distribution, energy level, appetite, changes in alimentation, thyroid enlargement or tenderness, changes in size of head or hands, asthenia, hormone therapy, growth, secondary sexual development, and intolerance to heat or cold. Completion of the review of systems concludes the health history. Before moving on to the physical examination, however, it is desirable to ask the patient if there are any health concerns or issues that were either not identified or not covered adequately during the history taking process. Even if the patient declines to add anything, asking conveys a respect and valuing of the patient's role in decision making about her or his health, and helps to reinforce the partnership between provider and patient. Thank you for your attention.